So question number 3. Hey, Dr. Islam, I heard on TikTok about splinting when it comes to constipation. What are your thoughts on this? Is this something that I recommend? So let me know in the comments down below if you've heard about splinting or if you know exactly what occurs with that. But in essence, what happens is you actually, for females, you actually put your finger in a private part to help push out the stool. Yes, this is a very common thing that people do. It's actually a very effective way to help out when it comes to issues with constipation. The big question is why? Why are people doing this? What is the kind of the mechanism behind this? Well, what we know is going on is that you actually may be having what's called a rectocele, which is an outpouching of part of your GI tract into areas like female private parts or other places like that. And that outpouching can make it more difficult for people to have a bowel movement. So for example, if you're one of those that does not have a very good bowel movement, you take things like Miralax, fiber, or supplements to help you go, but nothing seems to work. You strain, you push really hard, you don't feel like you're having a good evacuation, things are just not moving along, things feel like they're getting stuck or having pelvis come out. You may have a condition called pelvic floor dysfunction in which the rectal muscles are very, very tight. But in addition to that, it's very common for a lot of our patients to have things like a rectocele, which is that outpouching that's there, which will make it more difficult for you to have a bowel movement. So sometimes whenever you do the splinting, you're actually pushing into that rectocele to cause that stool to forcibly come out. And this is a very safe and effective way to help our patients to have a bowel movement, especially if they have a rectocele or an issue like that. Now, obviously, you make sure that you do it in a very hygienic way. And if this is a way that you can use the restroom more effectively, absolutely. We do recommend this for some of our patients we think who may have this problem, who have a more difficult time using the restroom. Now, if you're wondering if you are one of these people who has either a rectocele or a condition called pelvic floor dysfunction, there's testing that we do to help see how the rectal muscles work. Sometimes we'll do imaging to see if you have an outpouching that's there, to allow us to further see how the anatomy is, to see if you would benefit from doing this particular technique. But it's a great question that I got.